All right, informed consent violations. Did she fully explain the medical and ethical implications of prescribing birth control and abortifacients to her patients? Were women given full knowledge of embryology and what these drugs do? If not, this would constitute medical malpractice or deception. Certainly an infringement of the baby's right, but the woman, the mother, right? Do you think that she would have paid for the birth control? Do you think that she would have paid for the birth control pills had she known that it would not actually prevent the pregnancy? So the issue is here, of course, the baby is conceived, right? This small boy or small girl is alive, right? The pregnancy is 100% viable. However, because these drugs are abortifacient. So what is an abortifacient? Right? It's not. It doesn't prevent the ovulation. It doesn't. And then they will try to say, well, it. They will use it instead of him or her. They always want to dehumanize. They want to dehumanize the baby. So it is a blastocyst, and it failed to implant. I mean, that's the kind of language that they will use. These Dr. Dow and other types of abortionists like that. We'll use this type of language here, but of course the truth is that he or she, there's a small boy or a small girl, will be killed. But these types of poisonous, what happens is that it fails to implant. That is true. Not naturally. It's not a natural thing. This is these types of death drugs were given. So the informed consent, right? So do you think that these women, or most of the times these are young girls, 16, 17, 18-year-old girls that are taking these birth control pills. Do you think they would have, if they could understand embryology and all this stuff, do you think they would have been they would have consented to having their children die potentially potentially that human life were to die. And I would agree that some might, right? Some might because they are depraved and they do not have they do not have the full mental understanding of basic no, more morality and all this stuff. But many will not. A large percentage will not. So some people are just evil and they don't care about killing their own children. But many will not. They will say, "What? You're prescribing me a drug that will not prevent ovulation, but actually will kill my baby inside of the womb." And 100%, maybe not 100%. Some men are evil as well, but a lot of these men will not understand, and they certainly will not consent. To being involved with a woman that has taken these drugs, and that knowing that the decision to buy these drugs, whether informed or not, will lead to the death of that man's child. So it certainly is a deception, and it could certainly constitute as medical malpractice. I mean, you have to explain that, and she knows. I mean, she knows. But what is it? I want some birth control. Oh, here you go. Here's my pen on the prescription pad, right? And here you go, in and out, right? Very very quickly. There's no type of discussion about the fact that no. Then she will say, it's an abortive patient, and the blastocyst will fail to implant. Oh, really? Okay, so it's not a baby. Well, it's a blastocyst or a zygote or whatever kind of dehumanization um, they want to to try to argue, but it's a flawed argument. And then here's the worst part is that they will actually pay to kill their own children, right? The woman it's not a patient, it's a customer. The customer will pay and a lot of people, they will understand that they're just evil and they want to kill their own children. Why? To be able to, for convenience. That's all. Convenience. I heard one woman justify her she understood it was a baby, and she said, "I'm gonna blast." So she already had the abortion, and she said, "I blasted that baby back to heaven." That's literally the worst that she is. I blasted that baby back to heaven. So she knows she's evil. She's just an evil, evil. I call her a monster, but that would be an insult to monsters. Yeah.